Over the past decade, visits to the emergency room by youth in distress jumped 75%. And that was before COVID-19 and the strange and often difficult times in which we're living. With us now on how the 16 to 29-year-old cohort is holding up during all this, both from their homes in the provincial capital, we welcome Dr. Bjug Borgundvaag. He is director of the Schwartz Reisman Emergency Medicine Institute at Sinai Health System and an associate professor in the Department of Family and Community Medicine at U of T. And Jennille Seedial. She is a peer supporter at the Toronto-based young adult mental health facility called Stellas Place. And we are happy to have both of you on the program tonight for what is obviously a very timely subject. Jennille, let's get you going first here. The 16 to 29-year-olds that I just referred to, in your experience, how are they coping during this COVID crisis?
I think it's I can give you a very broad answer as it's really individual. There are some people who are really thriving, some folks who naturally are quite introverted, who are taking on things like baking and new projects at home. And then there are some of us who don't have those same lived or home environments, who maybe don't have privacy or are navigating sharing space with roommates or pets or children who don't have daycare and childcare at this moment. So it's very fluctuating, but I would say that wholeheartedly, I'm seeing so much youth resilience, so many new creative ways to create community, things like Club Quarantine, which is this incredible queer platform on Instagram where there's an opportunity to party or, you can mute your microphone and your video, but just these incredible innovative ways to share, get some FaceTime in and make new connections that maybe otherwise you wouldn't have made before COVID-19. So
Gotcha.
Very fluctuating, but I would say a lot of youth resilience is what I'm seeing right now.
Okay. Dr. Bjug, what are you seeing, for example, in emergency rooms related to these times?
We are seeing, as you mentioned, there has been a significant increase in young adults presenting to the emergency department in the last number of years. So I would say that it's definitely on the radar. However, I'd say in the last couple of months, the level of distress that I've been seeing in young people coming to the emergency department has been heightened. So these are people obviously who are having challenges managing and coping, not necessarily the ones who've been thriving. And my impression is that people feel quite alone, especially with the isolation, and a lot of people are very scared.
Let me follow up on that. When they specifically tell you, I am anxious about X, Y, and Z, what are those X, Y, and Zs?
So some people come in and say specifically that they're having a hard time coping with anxiety. Other people have, I think, other physical manifestations of anxiety that bring them in. We see a lot of people who come with episodes of chest pain or palpitations, disrupted sleep, general feeling of being alone. So people come in with a whole spectrum of things. Some people come in and just say, I'm anxious, I'm alone, and I don't like it. But many other people come in with physical complaints that are hard to describe or hard to express.
And just to be clear, the chest pains are not a pending heart attack, it's just anxiety, is that right?
Typically, like a 23-year-old who's stuck at home and isolated with no past medical history is not having a heart-related problem. It's not impossible, but it's not terribly common either. So they get an evaluation in the emergency department, but at the end of it, usually we have a conversation about how they're feeling.
Gotcha. Jennille, maybe you could just take a few seconds here and tell us what you actually do at Stellas Place.
Yeah, so my role at Stellas is a peer supporter, and that embodies multiple roles. So I'm part of the incredible peer clinical integration, which means that I'm a part of the DBT clinical team. So along with two amazing facilitators, I'm a peer supporter in our workshop, which means that I get to be a part of incredible consults between clinicians and some experts or facilitators that come in. I support our BBC, which is our online peer support platform. It's an app that you can download to any of your devices. So I offer peer support there. I also support our DBT Refresh, which is an opportunity for anyone who's done DBT in the past to come to our drop-in workshops and build a bit of community that's peer-led around some of the skills that they have been applying into their lives. Yeah,
Well,
so I'd say
let me
that's a
jump
bit.
in there because you just talked about drop-in centers, and I know Stella's is well known for that. But can
Yeah.
you still do that in an era of physical distancing?
Really good question. So, what was really unique about Stella's Place was our cafe space. So, if you've ever been to our space, you know that as soon as you walk in through the doors, there are couches that await you, there are desks, there are tables, and it's a space for young folks to come in between the hours of 12 and around 5 p.m. Monday to Thursday and just play games or just interact. So we've integrated that cafe space into our BBC, which is on our online platform. So folks can still have that drop in essence between 12 and 9 p.m. Monday to Thursday with a peer supporter. So it's all virtually kind of been simulated.
And do you insist that people keep the 2 meter distance between each other?
So the conversations are one at a time with a peer supporter.
Okay.
And we actually just introduced our virtual studio. So that was also a drop-in program where young people could come in and create some art together. And that's on Wednesdays. I believe it's at 3 p.m., but don't quote me. Check out our Instagram or connect at stellasplace.ca. And that's also run by two of our peers, Anmal and Kayla. And that is opportunity for folks to be able to go to a Zoom room and see each other and have conversations amongst each other. So definitely not 2 meters apart, but more opportunities to talk as a collective instead of just a one-on-one element.
Okay, well, this gets me to Dr. Bjug because I think we need to know at this stage whether this kind of virtual care can be as effective as actual person to person in the same room, 1 foot, 2 feet apart, which you might normally do under different circumstances.
I think it's got great potential to be very beneficial. I think partly it may be generational. I think younger people in general feel connected virtually and electronically. I have 3 kids in the age group that's the catchment age for Stellas Place, and they're very comfortable having private conversations online and making connections with people that way. But I think even adults enjoy some face-to-face time and feel a little bit starved. And I do think there's tremendous potential. I've heard of places where they're using virtual appointments for, I know that in our family practice unit, many of the interactions are virtual now. And I've even heard of emergency departments that are doing the same. And I think patients like it and find it helpful.
Jennille, I guess your generation is what's known as digital natives, as opposed to my generation, who are considered digital immigrants. Would you confirm the fact that it seems that your generation is really quite comfortable and quite content to do virtual treatment, and you don't see much of a difference between that and doing it in person?
I would definitely say that young adults or kind of that catchment age have been utilizing kind of this virtual reality for a long time, and that there is a lot of comfortability having these Zoom conversations or FaceTime. But I will also hold space for some folks who have a lot of anxiety around using a webcam or having their backgrounds be seen where they're living, or for folks who don't have that the same amount of privacy that they would have going into an organization or having those conversations in a place that has more privacy, or a place that maybe is a park or a bit more public. So there are some young people who are struggling to adjust to that virtual platform. But I would say, the general consensus is that folks have in my age range have been utilizing these virtual realities for a little bit longer, and there's some comfort there. And for the folks who are still adjusting, that's what we're here to do, is to say that, hey, I have a bit of anxiety around being on a webcam too, and it's a little bit awkward talking to a computer instead of a real person. And so supporting that transition is a part of my role too.
Jennille, how did you get involved with Stellas Place to begin with?
It's a good question. It's a little long-winded, so I'll try to summarize. I was a part of an incredible City of Toronto project called the Community Healing Project, and that's partnered with Stellas Place. So we have our training manager, which is Asante Houghton, who took peer support training from Stellas Place and modified it to fit the, parameters of CHP, or the Community Healing Project. I was a part of that from 2018 until just about the ending of the year, in which we got incredible funding to continue for the next 5 years, where I became a full-time staff member. So my role in that project was a youth peer mentor coordinator, so YPMC.
But
where
I'm wondering, were you a client in the first place?
Yeah, so I was a participant for 3 months taking this training. And then for the next 3 months, I went into community where typically you live in. However, I was placed somewhere else. I was placed in Malvern, facilitating workshops around things like trauma, grief, vicarious trauma, loss, anxiety, mindfulness. So all the things I learned in peer support training were things I could then go out into my community and then facilitate. So I was a part of this program or project for almost 6 to 8 months. It really opened up a lot of doors for me, tremendous doors in facilitating, sharing my story, sharing my voice, and connecting with peers on a level that I hadn't previous. And that's when I became a staff member, was the year after, which was 2019. So full-time member of that project as a staff. And then at the same time, I signed up for Stellas Place DBT program as a participant. So I was in that program or workshop for 3 months.
DBT standing for?
Dialectic Behavior Therapy.
Okay.
So an amazing workshop that supports folks on regulating their emotions, improving their interpersonal relationships, being able to deal with distress and cope a little bit more effectively. So I did that for 3 months. And then I was offered a role to then support the workshop, where I did that for about 6 months to a year last year. And then I applied to become a full-time peer supporter. So now I'm a full-time peer supporter at Stellas Place, where I also support the DBT program along with BBC, DBT Refresh, and Cafe, and all the incredible things that Stellas Place has to offer.
All the incredible things and incredible acronyms as well. We're going to put those aside for now. Dr. Bjug, tell me this. Anybody following this COVID-19 story knows that the most vulnerable generation are the 80 pluses who are, if they get this, at much more risk of dying than any other cohort. But there clearly is some vulnerability in this 18 to 29 group as well. Why do you think they might be particularly anxious as it relates to COVID-19?
Well, I think for a lot of people, this is like a once in a lifetime kind of event that's going on. We have no precedent for any of this. People are being, I think, told how to behave and what to do in ways that make them uncomfortable. People, generally speaking, I think, like to go about their business and live their lives independently. So having the kind of restrictions placed on them, I think, is a challenge for a lot of people in the public, and I think young people are no different than anybody else. I think the other thing that may be an issue is I think that frequently younger people are more likely to live alone. So whereas other people may be with other people, at least the people I've been seeing in the emergency department seem to be people that are kind of stranded at home alone and feeling very isolated.
Well, let me follow up with this. Let's say you're born in 1990. When you were 11 years old, there was 9/11. And then 7 years later, there was the Great Recession. And somewhere in the midst of all that, you had SARS as well. And I think in the province of Ontario, you had a case of mad cow as well. Now here we are in 2020, and we've got the worst global pandemic in 100 years. I guess you could be forgiven if you're, 20 or 30 years old right now for thinking that the world is a pretty screwed up place. Do you see lots of that?
Yeah, I think so. Although, I think as Jennille indicated, people are pretty resilient. People are very resilient. I was having a fun conversation with one of our nurses when I was working one day last week, and we were talking about SARS, because I think SARS, at least for people who work in healthcare, was a defining moment for us in 2003. She's been a nurse working in our department for a number of years, and we both had a laugh when she realized she was in grade 2 during SARS, and still in high school during the Great Recession. So these things, they've been aware of them, but I don't think it's had the impact that this current situation has had directly on people as individuals.
What's your view on that, Jennille?
Yeah, I think that Dr. Bjug really hit the nail there. I think that COVID-19 has really impacted us as individuals and as a collective. So you're really seeing some universal experiences between young and older folks, and it's not as different when you talk about needing connection and wanting to be outdoors and needing to access things. So I think that there's some really some themes that are really overlapping, and that we're really seeing the impact much stronger than we ever have. At least I can speak from as someone who was born in 1990, that many of those things that you mentioned didn't impact me. And I couldn't tell you a specific memory of those times the way that I, very clearly in my mind can feel in the future. I'm going to be able to tell my children and grandchildren COVID-19 and all the things that I experienced within the current state of the world.
Have you turned 30 yet?
I just turned 30 in February.
Congratulations.
Thank you. I made it.
You're not part of this vulnerable target group anymore. You've hit the age of 30 and now it's all easy sailing from here on
Apparently,
in, right?
once you hit 30, you've figured everything out, right, Steve? Right, Bjug?
I got news for you. It doesn't quite work that way, as you'll discover. But tell me this. I mean, you heard that checklist of things that I just listed off, starting with, actually there was the worst recession since the Great Depression, I think in 1990, the year you were born. And then, 9/11 and off to the races we go. Do you have any reason to suspect that makes your generation more prone to anxiety as opposed to maybe those who were born in 1980 or 70 or 60 or 50 or whatever?
That's a good question. I think that, as we experience things, we begin to learn our individual ways on how to cope. And so in the same ways that I look at the dark moments in my life and the things that I've experienced that I, in those moments wish that hadn't happened to me and wish that I could solve right away. I know now that as I've, turned 30 and as I continue to get a bit older, I can see all the lessons and all the things that it brought me in regards to being able to cope and being able to see the light at the end of that tunnel. And so, I think my experience shows me that I'm going to be able to use this COVID-19 time to rediscover new ways to navigate the world, new ways to build community, new ways to deal with my stress, to deal with my frustration, to deal with a bit of that stir craziness that I'm experiencing at home. And so I would say that, the more that we experience things, the more that we're able to figure them out. So I think in the moment, it's hard to see that. And the struggle is very real for so many of us. It's not an easy time. But we are going to make our way through it. We're all in this together. And that's kind of where I see things going. So yeah.
Dr. Bjug, you mentioned earlier you've got 3 kids. How old are they?
My kids are 23, 25, and 27.
As a firstborn myself, I kind of wish you'd said 27, 25, and 23, but that's just me. Okay. Premier Ford's got this expression where he says, I recognize people are getting squirrely. And I wonder, given that your kids are right in the age that we're talking about right here, how squirrely are they getting and how much longer can we basically force them to stay inside and away from all of their friends, which of course they'd normally be doing right now?
I don't know that I can use my kids as the best example. They have their father coming home every day, telling them stories about things that I see in the hospital. So my kids are probably more aware than most of the serious consequences of failing to socially distance and the chances of infection. Having said that, one of my kids lost her job, was laid off. Happily, she's living at home, so it's not a disaster for her. She's able to continue to survive. Another daughter is independent and out on her own, but her job is in jeopardy as well. So in truth, they have real concerns about what's happening to them and where things are going. I guess we're going to find out how things work out in the next few weeks.
How squirrely do you think they're getting right now?
They're pretty good. Honestly, they're pretty good. I don't know if we're all introverts and just happy to be at home. I think extroverts have a very hard time with this, but so far they're pretty good.
Okay, good to hear. Jennille, we have of course heard of the expression of Gen Xers and Gen Y and Generation Z, but I have just now heard the new expression about Generation C, as in coronavirus.
I haven't heard this.
You haven't heard this? I'm happy to be the one to break the news to you. So you haven't heard this term before, Generation C, those who are coming up in the coronavirus and therefore will have sort of special pathologies or anxieties that these other generations, also had, but in a very different way?
I have not heard this term, but I can
Hmm.
see some merit to it. I can.
Do you think there will be long-lasting effects of this pandemic on Generation C, if I can call them that?
I think it's really hard to say and to generalize a group of people, but I do think that there is going to be some things to adjust, like getting back on TTC, being back in crowded spaces. What is that experience going to be like for folks who have been socially distancing themselves? At the same time, I think there is a huge gratitude practice going around right now. So folks who are going to be really grateful to go back to work or to do the things that maybe were mundane or maybe were things that they really avoided doing or hated doing, that now we can't wait to get back to that routine and that normalcy. So I think, yes, there are going to be some adjustments to look forward to or not look forward to. But I do think that what I'm seeing is, like I said, a lot of resiliency and a lot of just so much newness, new ways to do things. And so it's hard to say. I think some of us are going to feel that crunch, and it's going to take us a little bit longer. And we are going to see some new faces at Stellas, and maybe Dr. Bjug will see some new faces who are having a bit of a tougher time. But I do think for the most part that folks are really looking forward to just getting back into the world, and are going to be grateful for just having that privilege to go back to work or to go back to the things that they were doing before COVID.
Yeah, Dr. Bjug, we don't really have anything like this to compare it to, so I suspect a lot what I'm about to ask you may not be answerable, but give it your best shot anyway. Do you have a sense of what the lingering effects down the road will be on this Generation C, as I've just described it?
I actually think they're going to be significant. There's a lot of young people that have had their education interrupted. The people that we see the most of in the emergency department are, we use this term vulnerable populations, but I think young people are especially vulnerable educationally and financially. We live in a city and many places in Canada as well where, it's quite a challenge to make your own way. And to have, the economy so badly affected by this, and then affecting the job market and other opportunities for young people, I do think there's going to be a sort of a resounding echo of this pandemic that we're going to be dealing with for a long time. And I think I'm especially happy that we will, continue. We've got a new partnership that we've started with Stellas Place, which is fantastic, and our plan is to have peer support workers in the emergency department. This program just launched at the beginning of the COVID pandemic, so we're still trying to work it out. But we want to keep people safe and people that aren't used to that environment. But I'm really, really pleased that we have this program, because I really feel that in the next coming period of time, however long that is, that we're going to be having to deal with the consequences and sequelae of these problems.
Well, we wish you both well with your work, and we thank you for spending so much time with us on TVO tonight. Dr. Bjug Borgundvaag from Schwartz Reisman Emergency Medicine Institute at the Sinai Health System, and Jennille Seedial, the peer support worker at Stellas Place. Be safe, you two, and again, thanks for joining us tonight.
Thanks so much, Steve. Thanks for having me.
Thank you for having me.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.